Increlex injection demonstration video.
Increlex, Mecasermin, is a prescription medicine used to treat children who are very short for their age because their bodies do not make enough insulin-like growth factor 1, IGF-1. This condition is called severe primary IGF-1 deficiency. Increlex should not be used instead of growth hormone. It is not known if Increlex is safe and effective in children under 2 years of age.
Please see indications and important safety information at the end of this video.
Welcome to the Increlex injection demonstration video. In this video, we will review how to use Increlex following the instructions for use. It is important to read the instructions for use before you start using Increlex and each time you get a refill. There may be new information. This information does not take the place of talking to your child's doctor about your child's medical condition or treatment. It's important to do the following. Inject Increlex exactly as instructed. Follow your doctor's instructions for the type of syringe and needle to prepare and inject your child's dose of Increlex. Do not share your child's needles and syringes with another person. Your child may give another person an infection, or your child could get an infection from them. Items required to administer the Increlex injection. You will need the following items to give your child their Increlex injection: 1 vial of Increlex, 1 alcohol swab, 1 gauze or cotton ball, alcohol to clean the skin at the injection site, 1 new sterile disposable syringe, and 1 sharps container for throwing away used needles and syringes. Always use a new, unopened needle and syringe for each injection. Only use single-use disposable needles and syringes. Never reuse disposable needles and syringes. Throw away used needles and syringes in a puncture-resistant, disposable sharps container as soon as you finish giving the injection. How to properly store Increlex. Now we'll talk about how to store Increlex. Store opened vials of Increlex in the refrigerator between 35 degrees to 46 degrees Fahrenheit, 2 degrees Celsius to 8 degrees Celsius, for 30 days after you start using the vial. Throw away any unused Increlex after 30 days. Do not freeze Increlex. If a vial freezes, throw it away. Keep Increlex out of direct light. Do not use Increlex after the expiration date printed on the label. How to prepare an Increlex dose. First, wash your hands before getting the medicine ready for your child's injection. Next, check the liquid to make sure it is clear and colorless. Do not use if it is cloudy or if you see particles. Then, check the expiration date printed on the label of the vial. Do not use Increlex if the expiration has passed. If you're using a new vial, remove the protective cap. Do not remove the rubber top. Next, wipe the rubber top on the vial with an alcohol swab. Before putting the needle in the vial, pull back on the plunger to draw air into the syringe equal to the Increlex dose. Then, put the needle through the rubber top of the vial and push the plunger to inject air into the vial. Leave the syringe in the vial and turn both upside down. Hold the syringe and vial firmly. Make sure the tip of the needle is in the liquid. Pull the plunger to withdraw the correct dose into the syringe. Before you take the needle out of the vial, check the syringe for bubbles. If there are bubbles in the syringe, hold the vial and syringe with the needle straight up and tap the side of the syringe until the bubbles float to the top. Push the bubbles out with the plunger and draw liquid back in until you have the correct dose. Remove the needle from the vial. Do not let the needle touch anything. You are now ready to inject. How to inject Increlex subcutaneously. Now you're ready to proceed with the Increlex injection. Do not give the Increlex injection if your child is unable to eat within 20 minutes before or after the injection. Choose an injection site: upper arm, upper leg, buttocks, or stomach area. The injection site should be changed for each injection. Use alcohol to clean the skin of the area where you are going to inject your child. The injection site should be dry before you inject. Do not fan or blow on the clean skin. Do not touch the injection site again before giving the injection. Lightly pinch the skin. Insert the needle into the pinched skin demonstrated here. Release the pinched skin. Slowly push the plunger of the syringe all the way in to make sure you have injected all of the liquid. Pull the needle straight out and gently press on the injection site with gauze or a cotton ball for a few seconds. Do not rub the injection site. How to dispose of needles. Now let's talk about disposing of used needles and syringes. Put used needles and syringes in an FDA-cleared sharps disposal container right after use. Do not throw away loose needles and syringes in your household trash. Do not try to touch the needle. If you do not have an FDA-cleared sharps disposal container, you may use a household container that is made of heavy-duty plastic, can be closed with a tight-fitting, puncture-resistant lid without sharps being able to come out, upright and stable during use, leak-resistant, and properly labeled to warn of hazardous waste inside the container. The used alcohol swabs, cotton balls, and gauze may be placed in your household trash. Do not dispose of your used sharps disposal container in your household trash unless your community guidelines permit this. Do not recycle your used sharps disposal container, and always keep it out of the reach of children.
For additional information, refer to the Increlex instructions for use on Increlex.com or call 847-787-7361. Indication: Increlex meclosermin is a prescription medicine used in children 2 years and older with short stature that have severely low levels of the hormone, insulin-like growth factor 1, IGF-1. IGF-1 is needed for normal growth. Increlex is not a substitute for growth hormone. It cannot be used for children with short stature due to low levels of growth hormone, malnutrition, when their thyroid gland doesn't make enough thyroid hormone, or when taking anti-inflammatory steroids used to manage inflammation. Important safety information: always give Increlex exactly as your doctor directed. Do not take Increlex if you are allergic to IGF-1 or any of its other ingredients. Report any allergic reactions. Increlex should be injected under the skin. Subcutaneous injection. It should not be injected directly into a blood vessel. Increlex should not be used after growth plates close, which happens during puberty. Increlex should not be used in children with cancerous tumors or a history of cancer. Hypoglycemia. Low blood sugar. Increlex should be administered 20 minutes before or after a meal or snack and should not be administered when the meal or snack is skipped. Checking blood glucose levels is recommended. The dose of Increlex may need to be adjusted until an appropriate dose is decided by your doctor. Intracranial hypertension. Increased pressure in your skull may occur because of cerebrospinal fluid buildup around your brain. Therefore, your doctor may require an eye examination at the start of Increlex treatment and periodically during the time you are taking Increlex. Lymphoid tissue hypertrophy. Lymphoid tissue hypertrophy is a non-cancerous increase in the number of immune cells called lymphocytes. Patients should have periodic examinations with your doctor to rule out potential complications. Slipped capital femoral epiphysis. Slipped capital femoral epiphysis is a bone problem where the top of the upper leg, femur, slips apart. This may lead to a serious condition where bone tissue dies due to a lack of blood supply, osteonecrosis. Get medical help for your child right away if your child develops a limp or has hip or knee pain. Progression of scoliosis. Your doctor will monitor you during treatment with Increlex if you have a history of scoliosis. Malignant neoplasia. There have been reports of cancerous tumors in children who received Increlex. It is unknown whether there is any relationship between Increlex therapy and new occurrence of tumors. Tumors were mostly reported in patients with rare genetic conditions of short stature associated with a higher risk of cancer, or in patients already at risk of cancer. The tumors were seen more frequently in patients who received Increlex at higher than recommended doses or at doses that produced IGF-1 levels above normal for age and sex. Your doctor will carefully monitor you during your treatment with Increlex for development of tumors. If cancerous tumors develop, your doctor will stop your Increlex treatment. Risk of serious adverse reactions in infants due to benzyl alcohol preserved solution. Serious and fatal adverse reactions can occur in neonates and infants treated with benzyl alcohol preserved drugs. Use of Increlex in infants is not recommended. The most common adverse reactions include low blood sugar, reactions at the injection site or throughout your body, and enlarged tonsils. You are encouraged to report negative side effects of prescription drugs by contacting Eton Pharmaceuticals, Inc. at 1-855-224-0233 or the U.S. Food and Drug Administration. FDA at www.fda.gov/safety/medwatch or call 1-800-FDA-1088. Please see full prescribing information for more information.